medical developments could turn the tide on cancers and some of the treatments?
Well, a very easy at-home saliva test could identify men at risk of developing aggressive prostate cancer. And there's also a new blood test we're hearing of today, which may be able to predict the risk of something like breast cancer returning, apparently 3 years before any tumour showed up.
Let's talk to Dr. David Lloyd, who's a GP on the NHS. Good to see you this morning, David. First of all, what can you tell us about this prostate test? Because we know it's a huge problem for men, prostate cancer, but we also know we're a little bit reluctant to go and get anything checked out.
Yes, I think that is the major problem with men, isn't it? But I think this is a very exciting development, and as you say, it's a relatively simple test, and it does seem to pick up a lot of men with prostate cancer. The problem we've got with the traditional testing, which is the PSA test, which I'm sure you've heard of, which is a blood test, is that it picks up a lot of people who haven't got prostate cancer and subjects them to quite invasive tests, which is a biopsy of your prostate. Things have got a little better since then. We've now got MRIs, which are very good at detecting prostate cancer and can sometimes alleviate the need to have a biopsy and make the diagnosis. So this new test is very exciting, and it promises to help men recover and live longer with prostate cancer. Because I don't know whether you know, but if you were to contrast prostate cancer with, say, breast cancer, which we're also going to talk about, I think the research is about 5 years behind on prostate cancer than it is with breast cancer. And us men have had a pretty raw deal of it. So it's a good thing that we're getting more tests and that we're detecting more prostate cancer. And one final point, there is an enormous study just starting in England at the moment, which is going to be looking at this in great detail and try and sort out what the best screening tests are for prostate cancer. And I would just make a special plea for black men over the age of 45. We know that black and Afro-Caribbean men have a much higher incidence and much poorer outcomes on prostate cancer. So if you are a black man living in England and you're over 45, please consider going to see your GP straight away and either getting enrolled in this research or getting a test that your GP can do, because that's the group that's really suffering at the moment.
Yeah, absolutely. I mean, looking at prostate and breast cancer, they're the two most common cancers with their gender, aren't they?
They are, and very, very similar in their incidence, and yet women do much better than men.
Well, you look at the breast cancer then, if you've already had breast cancer, obviously there's always a risk of recurrence. But this new breakthrough, which is a DNA is it a blood test? Yes. Yeah. It could actually look at the possibility of recurrence and detect it much, much earlier than we can do at present.
Yes, I think this is very exciting, isn't it? So this is a different group. This is women who've already had cancer and had treatment and are technically in remission. And it's picking up women who might recur. And this is a very exciting thing. And I think these research studies reflect that we're now getting better at testing some very specific parts of the DNA in human beings so that we can detect these things. And I think we're going to see more and more of these studies coming out. And it's no coincidence that both of these studies have come out this week, because there's an enormous conference going on where everybody who's very expert in cancer are talking about these things. So yes, I think this is a very exciting thing. One of the problems I have as a GP is when women come to see me years after they've had a cancer diagnosis and they've got some vague symptoms. And how do you decide whether to do more tests or not, or reassure or get further opinions? So this will be a useful thing for us on the front line.
But what is, if you can detect that you are more likely to recur within several years, what advantage does that give you as a medical professional, or indeed as a patient? Are there treatments available which can then reduce that recurrence likelihood?
Yes, I think that's one of the things we're discovering now is that it isn't just a one-off thing. You have your treatment for cancer, and then it either occurs and you get problems, or it doesn't. We now have good treatments that we can give on people who've got recurrence of disease. And it means that if we catch this earlier, we can be more specific in getting the right treatments for those sorts of recurrences.
Now, we've just mentioned these two breakthroughs, and you said prepare for more, which is wonderful news, really. Lots of people are going to be listening to you thinking, what do I do then? What do I do? Do I get hold of my GP now and ask for one of these tests?
Yes, I think that's absolutely right. You've made a very important point there. No, these tests are not going to be available yet for maybe several years. But I think the study that I'm talking about, the Transform study, is definitely available in my area. And so I think if you're a man with either prostate symptoms or are worried about your family history of prostate cancer, I think get down to your GP and have a good chat about it, because we've got some exciting new things we might be able to offer.
Well, good advice. Get down there and see what you can sort out. Dr. Lloyd, good to see you. Thank you very much indeed.
And maybe end up being part of a study.
Well, that'd be great, wouldn't it? I think there's a lot to be said for being involved in studies like that.